We're going to go ahead and get started. Thank you so much for joining us today. I am Jennifer Loudon. As you may recall from our July meeting, Tanya Rempert has stepped into a new role at PI, and so I will be acting as the network facilitator for this year. Please make sure you have your browser open and that you have your chat window open, and we'll be using those a lot today to communicate. We have a pretty robust agenda today. We are going to share with you some values that we've created for how we want to run this project and ask you to choose your adventure. We're going to do some breakout sessions. We will look at briefly at the plan and the needs assessment results for this year. And we will talk about how to get started with Shared Recruiter, with client transportation and the internships. Then we will have some breakout groups around technology and Medicaid. And we will look briefly at our support and communication plans for year 2 and next steps. So let's take a look at who is here. Oh, it's not loading. That's so awesome. I guess I will add you drop this in the chat. Please. Try to fix this. Oh, there we go. Hi, Heather. One second. Okay, it looks like it's coming in nicely now. Hi, Dana. Hi, Molly. Hi, Rihanna. Or Rian. Sorry, I missed that one. Whoops. And I should be able to scroll. Apparently not. Usually that works. Can tell that these did not get tested this morning. And we will do introductions again in the small groups. So apologies for this little snafu. What is everyone's favorite thing about fall? I'm very excited. Fall is my favorite season. And I agree with the large text here, which is the most common answers. The trees and colors are the best. I also love the crisp air, which I see a lot of. Oh, it looks like I responded to the wrong poll. Hilarious. Nice. What else is your favorite thing about fall? Sweaters. I do love sweaters. I was excited to get mine out. And happy birthday to the fall birthdays. I see that popping up a lot. And I haven't had a s'more yet, but you are right. Okay, we're gonna ask you to use the chat to choose your adventure. We are proposing 2 breakout groups today so we can dig in on your areas of need. If you recall, we used a poll at the end of last year to figure out what you wanted the network to focus on this year. And you said the areas of support that you really wanted the network to focus on were technology, helping each organization sort of improve either its actual technology or the way it used its technology. Medicaid, in terms of what Medicaid billable or figuring out how to improve on your billing rate and process with Medicaid, and advocacy we will talk about in November, advocating with the legislature for better supports. So our technology breakout group will be yeah.
We're not seeing your presentation.
Oh, well, that's a problem. Hold on. Thank you. Sorry about that. Let me fix it. That made the word cloud a lot less fun, I'm guessing. All right, that's got to be a lot better. Sorry about that.
Yes, that's better.
Thanks, Carrie. So the technology breakout group will feature a brief case study and lessons learned from one of your partner organizations, New Moms, who recently completed a successful transition to a new system that they're really happy with. And the Medicaid, we will do some follow-up. I got some answers to some of your questions from Friday's presentation with ICOI and SAGE, and also just reflect on questions you have that remain and identify any needs you have that could be addressed in our upcoming case study presentation. So if you could open your chat window right now and let us know in the chat, just technology or Medicaid, which group would you like to be in? And if you feel like, my organization doesn't really need help with either of these things, I would ask you to think about like, well, what are we really good at? And what could we offer some lessons learned and support and ideas to our colleagues around? And you could pick your group based on that. So take a minute to drop that in the chat for us, please, and then we will assign those breakout groups for a little bit later in the meeting. And you can drop that in the chat at any point as we move forward. One of the things that I really like to do is think about, okay, well, what are the values that should guide my work in any given day, in any given project, in any given organization? Because I find that really helps me make decisions in a way that's in the best interest of a project. And so all of us were talking about this, and we came up with this list of sort of 4 values that we want to drive how PI facilitates the McCormick Health and Wellness Network. So we want to make sure we're maximizing the value of the network for each organization. We want to make sure we minimize the burden of participation for each of you. We want to make sure we're operating from your perspective. And we want to ensure clear, concise, and effective communication with minimal volume relative to what can be avoided. So let us know if you feel like we're not operating with these values, or if you think a value is missing. So these are the 4 things that we're going to try to use to guide our support in decision making and facilitation of the network this year. But feel free to use the chat or the post-meeting survey to drop in any questions or ideas you have about other operating values that you would like to see for how the project or the network is run. We wanted to share those with you so you can hold us accountable to them, and we are holding each other accountable to them as well. This is a timeline that we looked at in our meeting in July. I just wanted to share an update. Obviously, we've completed the needs assessment, as well as a communication survey where everyone specified what their communication preferences were for this year. And today we're starting the process of synthesizing and learning. So synthesizing your needs into, breakout groups or learning collaboratives so that we can dig in on specific needs around technology and Medicaid and eventually advocacy. And sorry, any questions about the timeline at all? The timeline is essentially, we'll work in the learning collaborative groups to try to bring in the resources necessary to meet the needs of each organization in growing relative to advocacy, Medicaid, or technology, and make sure we're moving into implementation of those supports by about January for the remainder of the project. Feel free to drop any questions in the chat. Laura is moderating the chat, and we'll definitely let you know or let us know if there's a question we should answer right away. But this is still our plan for the year, and this is where we're at in the plan. And I'm going to pass it over to Carrie, who's going to just briefly tell you about what all the different organizations shared with us in the needs assessment.
Hi, everybody. So as you all know, or may not know if someone else took this outside of you at your organization, but we did a needs assessment for everybody about a month ago. And we got 78% of the network responded. So 21 organizations responded to the needs assessment, which is pretty good actually. And we asked some pointed questions around advocacy. And these are sort of like the high level takeaways that I got from a lot of the data that was submitted to us. So one thing is the majority of organizations prioritize and spend time on advocacy work. So 67% do that. And full and part-time personnel are mostly responsible for the work that's done. There are, in terms of what organizations are advocating for, various types of abuse and violence were the highest ranked. And the most important to advocate for among our organizations, and that was followed by healthcare and housing. There was a whole long list, but these were the ones that kind of grouped together the most and floated to the top. So all of the organizations who reported said that their advocacy work is at least somewhat effective in the majority, and the majority offered their advocacy staff as a resource to the network. So you can see here, nobody didn't think it was effective. So everybody thought it was at least a little bit effective. So that's really great. Go ahead, you can go ahead and forward. Awesome. So when asked in advocacy, how can the network help? These were some of the ideas that they gave us. And again, these were things that floated to the top. Training on advocacy, communications, engaging with the media, public speaking, etc. So training essentially on various advocacy areas. Collaborate with other organizations to offer a larger platform for the advocacy work. They were interested in having expertise provided to develop a policy agenda internally. They were interested in collaborating with other organizations to share an advocacy message, which I guess is very similar to the offer a larger platform. And then the last one is they requested support in creating marketing resources to that end. Now, something to note here is that the advocacy portion of this work won't start until November. At the moment, we're focusing on the Medicaid and technology. Okay, so for technology, 13 organizations, so 62%, said that they were interested in capacity building for technology. Of those participating in that group, the majority either are not currently engaged in efforts to improve their systems at all, or are engaged and wanting to use the network to inform the process. 2 organizations were happy with their systems and were wanting to share what they know about their process, what they've discovered, what the implementation was like, etc. And one of those people is going to be presenting in the technology group today. Secondly, most organizations want better information / expertise about effective systems so they can better plan and implement current strategies. Knowledge sharing between organizations is also a desire. So this is sort of what they want out of the technology group. And 3, 2 organizations have begun development on a client engagement app and could prove useful in providing support information to 7 organizations interested in participating in the Learning Collaborative. 5 haven't begun discussions internally of those people, and 2 have. So for the technology, so there were sort of 2 pieces that we were asking about. We were asking about like technology as sort of like internal facing systems, so databases, things like that, things that the organization uses, and the client engagement app, which is more of a client-facing technology resource. So the areas of need were really more based on the whole technology, internal technology. So they wanted the ability to measure outcomes, reduce duplicate entry, the ability for a system to talk to another system, if that's at all possible, and better reporting functions. Those are the biggest areas of need for everybody. And when we asked everybody how the network could help, what floated at the top was to provide information on successful systems, So people who have been there, done that, access to technical assistance with companies to assist in systems improvement. So any expertise that could perhaps help folks in their, with, you know, sort of like revamp their current systems or improve their ideas going forward. And then help obtaining funding for data tools and management. Those are the biggest pieces. And then, yeah, I believe that was all for that. Now there's a lot more data to this. So if anybody is interested in getting kind of like the full report, feel free to reach out to me. I'm happy to share it with you. There are no, most everything in there is anonymous. So yeah, that's it for me.
Okay, we're going to pass it over to Laura to really talk about how to get started with the shared recruiter, the client transportation, and the internship. Laura?
Good morning, everyone. My name is Laura Watsky. I'm handling the shared recruiter, client transportation funds, and internship funds again this year, much in the same capacity that I did last year. So the shared recruiter portion has already begun, and then the other two, client transportation and internship funds, will be sent out very soon. So first of all, the shared recruiter is, I'm already working with several organizations, and we've already posted a couple dozen jobs on different network job boards, and then reached out to universities and colleges in the area. And we've actually had one position already filled, so it's nice to have some early success. So if you have current roles that you need help filling, whether you have on-site, I'm sure you all have on-site jobs posted, but if you want something supplemented, feel free to send those my way. Jen, if you could advance it to the next one. So what is required from organizations in order to share positions to me? I need you to send documents to me in a Word format, just so that I can copy and paste, and it's easy for me to fit things onto existing systems and share those out to colleges and also to job boards. Please make sure that you highlight to me what is required of an applicant. So if there's a minimum education or minimum experience, specific degree that's required, make sure that you highlight that to me, just so that I know what is an absolute must. And then if you're also sending multiple postings to me, because we do have, like in some capacity, we have some limited slots, just organize your postings as far as like what is a priority. So I can post your top one or two if we have job boards that only have a couple openings at the time. But so like I said, we're in the middle of posting those right now, so send those as soon as you can. The email that I'm working with for that is recruiter@piorg.org. So if you have any questions, you can send me a follow-up as well. And then for client transportation, so the survey that we conducted said 14 organizations are interested in participating. We're hoping to give about $2,000 per organization. So most of the organizations that are participating this year did participate last year. So these are funds that will go towards supporting clients in fulfilling their service plans. So whether you're giving funds to somebody to take Uber, Lyft, or taxis, gas cards, to put car seats in cars so that children can be transported safely. These are all features that would fall under that category. I know that COVID has changed this in some capacity, so if anybody has any questions about that the group needs to discuss, please feel free to put them in the chat right now. But we will be sending out paperwork to those of you who would like to participate, so that you can read through all the requirements. You'll have to fill out a client transit log, just keep track of things so that you can participate then in the survey and the follow-up in the spring. So you can expect, Jen, can you advance one more? Okay, so there's a question in the chat from Heather Mleinik. She says, since some clients are not comfortable taking Lyft because of COVID, can we supply them with gas cards instead? Yes, absolutely. And that is something that we also would like to just document, that because of COVID, things are changing a little bit. So we just need to keep that record. And if there's anything else that COVID is changing, please make us aware of that, just so that we can record that in our findings. But since the clients are being given the gas cards, just make sure that we're recording the mileage that they're, spending to and from the different places that they're going, just so that they're still fulfilling their service requirements. Let's see, when will the transportation funding be made available? So my next slide is, if you can sign and submit the MOU by November 1st, and actually probably we're going to try to move that up. Just the earliest you can get it back to us, the better. In the next 2 days, I will get the MOUs out to you. So you will receive the MOUs by October 1st. If you can send it back to me as soon as possible, then I will send the funds back out to you within 30 days of receiving your signed MOUs. So you will absolutely, by the latest, receive that back by November, and then the funding can be used as soon as you receive it. Let's see. Gil is asking, is there a limit to how much one client can use, a cap? We really haven't had that question come up in the past, or at least not to my knowledge. Did anybody run across that last year? As far as I know, the funds were really dispersed across several clients. So I guess that might be something that we have to follow up and get back to you on, but we haven't had that come up before. So let us look into that and get back to you. But in general, it seems like the funds have gone out to several different clients. Okay, Jen, could you advance to the next one, please? Okay, and then the paid internship funds operate in much the same way, the same way that they did last year, and in much the same way that the transit funds are allocated. There are 15 organizations that indicated that they were interested in participating. And so the internships would be $2,500 per internship. And the organizations who are interested in participating should be able to fund 1 or 2 interns. So that would be a follow-up question that I'm going to be asking everyone. If anybody knows offhand right now, I would ask that you put it in the chat as far as how many interns your organization is interested in funding through this. You can just type in 1 or a 2, but we definitely will be able to fund 1 internship for every organization, and then 2 for hopefully all those organizations that are interested in having 2 interns funded. So again, consideration must be taken for COVID, just as to whether and how internships can safely happen, whether or not your staff is on site, or if you're going into locations and working with clients, and just how that intern would be affected. So take that into consideration. If there's any question that you want to ask to the group, feel free to pose that now. But same way, Jen, if you could advance the slide. The organizations that are interested in participating would, you've already completed the needs assessment and indicated your interest in participating, receiving an intern. So if that has changed, please let us know. You would then complete the MOU, which I will send out by October 1st. And new organizations would complete a full MOU, and existing organizations or returning organizations would just have to sign the renewal. And the deadline is November 1st at the latest, but we ask that you try to get it back sooner. Hopefully, we'd like to get funds out in October if possible. So you will definitely receive your funds within 30 days of returning your signed MOU. So really, the sooner that you complete all the paperwork on your end, the sooner we can get it back to you.
Laura, can you remind us of the criteria for the internships?
Yes. So the internships should be, so they can be somebody that you have already hired. That is fine. Or it can be somebody that you are going to be looking for. We are looking to fund people of color, people who have second language skills, people who are from the organization, or from the neighborhoods that your organization serves, so that we are working within the community and building up a pipeline of counselors of color who are serving their communities. And again, the idea behind the paid internship, the $2,500 is hopefully making this, enticing them to continue in this work. So are there any questions about that?
And so the interns have to be doing counseling too, is that correct?
Yes, they should be working in that capacity, yes.
I don't see any new questions about the internships.
Okay. Okay, so again, I will get those MOUs out by October 1st, and you would get, the sooner that you can return it to me, the sooner you will get funding. I will be asking just for the address that you want the check mailed to, or to whose attention, but within 30 days of submitting all of your paperwork, you would get your funding. And so once you receive the funding, your organization is then responsible for paying your intern. And then we ask that you participate in the evaluation data collection that will happen around April of next year. Are there any other questions? Okay, so I have a good list of who is participating. If something changes, please send me an email. And I'll be communicating about this just at my normal email, laura@piorg.org. And you can expect the MOU application to go out by October 1st.
Great.
Okay, thank you.
Thank you. Okay, we are way ahead of schedule, but I still think a stretch break is valuable, especially when we all are spending so much time on these online meetings. So I'm going to invite people to take a 5-minute stretch break and come back around 10:37 or 10:40. We'll call it 10:40. And when we come back, we will be headed into our breakout groups to really dig in deep on technology and Medicaid. So we'll see you back here at 10:40. Thank you.
For a lot longer, but hold on. Oh man, I don't know how to save this. Go to File.
Harry,
Yeah.
I can save it if you'd like, because you had made me a co-host. Share my slides so I can save it. I have the ability.
Save the chat for me. Thank you so much. If you
You're
can figure
welcome.
that out, give us like a minute so she can do that. I don't know why it's not working for me.
No problem.
Thank you.
Okay,
Stop recording as well.
I have it
Get
saved.
it? Oh, thank
Yep.
you so much, Dana. You're a
You're
lifesaver.
welcome. I'll email it to you.
Thank you.
Dana,
All right. Thanks, everybody.
Technology.
Thanks, Dana. Okay. So it looks like we're going to finish up early. So it is a special Tuesday gift to everyone. There's just a few more things that we want to go through. One, like what our support plan is for the year. Obviously, as you discussed in the technology small group, we want to do these focused learning collaboratives. So there'll be some around technology. We decided we would need 2 for Medicaid. I don't know how many you decided you might need for technology. And we'll have some around advocacy rolling in a little bit later in the year. We think we'll probably have these large group meetings every other month, but really as needed. If it makes sense to target everyone with some of the information, then we'll have the large group meetings. Otherwise, we'll probably continue to work mostly with the focused learning collaboratives to try to really meet each organization's need to make progress on technology, Medicaid, or advocacy infrastructure. And we know it's just a wackadoodle year. So we really want to keep a pulse on the changing needs relative to what COVID is throwing at you. So there's actually some questions in the post-meeting survey today. So please let us know if there's anything that we really need to be aware of relative to the impacts of COVID on your operations and infrastructure. And let us know if that's something that we need to respond to or transition around at any point. We will do our best. Carrie, did you want to do this or am I going to do this? I'm sorry, I can't remember.
This one's you. I was going to do the website.
I got it. We work to try to really ensure that we're customizing our communication to your needs because we know that there was quite a bit of communication relative to the network. So you did receive a communication survey to ask you specifically what you wanted to know about in 2020. And we are only using those results. So it's kind of a clean slate situation. So if for some reason you didn't respond to that survey, you can use this little link right here, the EE Pearl, to tell us what communication you want to receive, especially relative to the focused learning collaboratives. Everyone will get the newsletters, everyone will get training information and meeting announcements, but otherwise we're really trying to customize the messaging to everyone's interests. And if for some reason you want to update your preferences, you can also use this link to update your preferences. Continue to use email as our primary format of communication, and probably one email per area or issue or group. But you know, technically we could also use web pages and then just send you emails with reminders to visit the web page. And we're open to other genius ideas. It seems like email is the easiest sort of one-step thing, but in the post-meeting survey, there is room for you to give us better ideas on how to effectively communicate with you. So please let us know. And it
Also,
looks like
I want to add though that we always keep the website updated. So usually if you're missing information and you're like, what's the thing? You can always go to the website and you can usually see what's going on there, or email us, just so you know that we're trying to keep that as possible.
Thanks. And Laura dropped that communication link in the chat. So if you feel like you haven't been getting what you need, or if you want to take a look at what you've got, go ahead and respond to that. But that's our general communication plan this year. And if you want to weigh in on that, it is in the post-meeting survey, which is very short and should take you about 5 minutes, FYI.
And so I'm going to share. Can I share my screen, Jen?
You should be, yeah, here, let me stop and you go right ahead.
Okay. So I'm going to show, we have a website, and most of you have already seen this, but if there's new people or folks who haven't seen it, it's piorg.org, McCormick Network. And basically everything is here right now. We have all of our past newsletters, which give you info on just all kinds of different things of what was going on in the past. We have up at the top our 2021 funding year, so where we are right now, what the project timeline is, and then all of our meetings are just going to start stacking up down here. So you can see any of the slide decks and the meeting replays or any of that. So you can always come back here and see, check back into how everything was going. This was from last year. So last year, I'm sure many of you came here to check out all of our video materials and everything from all of these meetings and our network-led PDs. So anything that is new that is like a resource, we will put it on the website. Also, if you did not know, we have a YouTube channel for Pi, and on the YouTube channel is where you can find, oh, there's Jen. If you go to Pi.org, you can see there's a playlist for all of McCormick's stuff. So you can come in here and you can see all of McCormick's past PDs and everything all stacked into here. I believe the very first session that we did, our informational session, is right here, and even our whoops, even our Q&A is in there from last week for Medicaid. Also, if you go to Pi.org, if you just go to our main website and you scroll to the very bottom, you can get to the Health and Wellness Network here. And this will take you to the Health and Wellness website. We're going to be updating this website in January, so this is all going to be completely different. But for now, you can find everything you need here. And in the newsletter that goes out, we also put a lot of updates in the newsletter.
Thank you, Carrie. All right, questions about year 2? Any questions? What else do you need to know? Is there anything we didn't talk about today that you thought we would or that you think we should? What information do we need to help you move forward in the best way possible? You can either unmute yourself or you can drop it in the chat, totally up to you. And I was a teacher, so I'm happy to use a little wait time.
Hi, Jen. This is Meher from Apna Ghar. Thank you for this really, learning-oriented session. This is really, really helpful, and I really enjoyed Dana's presentation on technology, and I have loads of questions for her, so I'll reach out to her separately. I just wanted a little bit more clarity on the Advocacy Learning Collaborative. Since there wasn't a group that we did here, so is that something that we're gonna pursue later? Because I know as Apna Ghar, we are interested in that area as well. So if you could just share a little bit more about how we're gonna do that.
Yeah, so that's a learning collaborative that we're gonna start in November. So we will roll that in and we'll probably have another large meeting so that we can start that with all the organizations. And we'll do something similar today where we'll focus in on, what are people's interests and needs around advocacy, and, will we just have one learning collaborative or do we need to do a little customization within that? If you have ideas right now, or if there's something you want us to start thinking about now, please feel free to drop it in the chat, or you can also include it in your post-meeting survey. But our plan is to start working on that in November.
Thanks, Jen. Okay.
Thank you for your question. I really appreciate it. Any other questions? And while we're waiting, a super special shout out to Dana. That was really great, and we really appreciate you sharing everything with us.
Thank you for the opportunity. I love talking about it, so would be happy to follow up individually or if there are broader questions too.
That's really great. Thank you. It's so great to learn from one another. I like to make new mistakes. I don't want to make a mistake that somebody else has already made. So it's really great to learn from one another.
We've made lots, so so you don't have to.
It's the beauty of a collaborative.
That's right.
Anything else, feel free to drop it in the chat. There's a question at the end of your post-meeting survey where you can drop it, but let us know. Our next steps: send your open positions to the recruiter at any time. Again, that email is recruiter@pi.org.org. And as Laura said, transportation and intern funding, the MOUs will be emailed this week, and we would love for you to, I know it said November 1st before, but we would really love for you to return them earlier than that so we can get that turned around really quickly for you. Medicaid and technology, we will start those small group learning collaboratives in the next 3 to 4 weeks. There is a Medicaid case study scheduled for October 9th where we're going to specifically walk through the decision process and the transition process of moving to Medicaid with one of your partner organizations. So if you are in the technology group, but you are also interested in that, and you have any questions that you want to be addressed in that case study, feel free to drop them in the chat now or in your post-meeting survey. The time on that is TBD, but we'll get that out ASAP. as I just said, we'll begin advocacy, learning, collaborative development in November, and we'll also start working on a year 3 grant application in November. We have been invited by McCormick to apply for year 3, which is really great news. We just found out last night. And they're not doing an open process this year, so it's great that we got invited. And we will see what needs we can address going forward. And last but not least, please complete your post-meeting survey. There's a couple really key questions in there that'll help us start thinking about this grant application and help us really continue to target to your needs going forward in year 2. And Laura, if you could drop that link in the chat, people could open it and do it right now. It really should only take 5 minutes. It's not very long. And here is our contact information if you need it, or if you have any more questions at any time, please let us know. So I'm going to ask you to, since we have a little bit of extra time, go ahead and open that SurveyMonkey link. And if you can complete that on your way out, that would be great. And we're happy to sit here and wait if you have questions. Otherwise, we look forward to seeing you in your learning collaboratives in a few weeks. But if anyone has any specific needs or questions, feel free to unmute yourself now and let us know. And let us know if you like the small group format. Is that something we should continue, the little breakout groups? Otherwise, we are done.